My name's Beth Graham, midwife and lactation consultant, and I have a few top tips for you. One of which is make as much time as possible to have skin-to-skin contact with your baby. If the baby is near you, it can feel much safer and much calmer. If she's got her head physically touching your body, she'll hear your heart beating, your tummy gurgling, your breathing sounds, and these mimic the sounds she was experiencing in the uterus and will help her to stay calm and relaxed. This can be done by mummies and by daddies. It doesn't have to be naked skin to skin, it can be just physically the baby's ear touching your chest. The babies often are very unsettled, not just because they're hungry. They could be lonely, they could be tired, they could just be overwhelmed, and by putting them near your body, this will really calm the babies down. Another tip is to get help early if you're having a problem, no matter how small it may be. Don't put up with it until it becomes a big problem. For example, sore nipples. If your nipples are sore, the baby's probably not latching correctly onto the breast. This means the baby won't actually be able to transfer much milk, will work very hard and then go to sleep tired, wake up very quickly because they're still hungry. If you can correct this quickly, then the baby will feed better, have a good feed, and then settle back to sleep, which will give your nipples a chance to recover between the feeds. It's really important that you don't put up with the pain and think, I'm the mummy, I'll put up with the pain. The baby's feeding, the baby's okay. The baby may be sucking, but not actually transferring milk. So get this right, and the baby will be happier, and you'll be happier as well. Another tip is to introduce a bottle to your baby between 3 and 6 weeks if you want the baby to have some express breast milk from a bottle to give you some space to spend time with your partner or to go out and have your hair cut, for example. If you introduce a bottle too early, that can mess up the supply and cause problems for you and your baby. If you leave it too long, the baby may refuse the bottle and then never take a bottle, which in itself can cause more concerns for you. Try and introduce the bottle to the baby, but make sure the baby copies the breastfeeding technique. So rub the teat of the bottle on the baby's top lip, encourage the baby to lift their chin, open their mouth wide, and then give them the bottle. This will then remind the baby when it comes to breastfeed to copy this technique, and things will go more smoothly for you.